Niraparib. Niraparib, sold under the brand name Zejula, is an anti-cancer medication used for the treatment of epithelial, ovarian, fallopian tube, or primary peritoneal cancer. It is taken by mouth. The most common side effects include nausea, feeling sick, thrombocytopenia, low blood platelet counts, tiredness and weakness, anemia, low red blood cell counts, constipation, vomiting, abdominal belly pain, neutropenia, low levels of neutrophils, a type of white blood cell, insomnia, difficulty sleeping, headache, lack of appetite. Niraparib was approved for medical use in the United States and in the European Union in 2017. Medical uses. Niraparib is indicated for the maintenance treatment of adults with recurrent epithelial, ovarian, fallopian tube, or primary peritoneal cancer who are in complete or partial response to platinum-based chemotherapy. In October 2019, the indication for niraparib was expanded to include people with advanced ovarian, fallopian tube, or primary peritoneal cancer treated with 3 or more prior chemotherapy regimens and whose cancer is associated with homologous recombination deficiency HRD positive status. HRD is defined by either a deleterious or suspected deleterious BRCA mutation or genomic instability in patients with disease progression greater than 6 months after response to the last platinum-based chemotherapy. In April 2020, the indication for niraparib was expanded to include the maintenance treatment of adults with advanced epithelial, ovarian, fallopian tube, or primary peritoneal cancer who are in a complete or partial response to first-line platinum-based chemotherapy. In the European Union, niraparib is indicated as monotherapy for the maintenance treatment of adults with advanced epithelial, FIGO stages Roman III and Roman IV high-grade ovarian, fallopian tube, or primary peritoneal cancer who are in response complete or partial following completion of first-line platinum-based chemotherapy, and as monotherapy for contraindications. No contraindications are listed in the prescribing information. Side effects. The most common side effects in studies were low blood cell counts, namely thrombocytopenia in 61% of patients, severe in 29%, anemia in 50%, severe in 25%, and neutropenia in 30%, severe in 20%. Other, mostly mild to moderate side effects included nausea, fatigue, and constipation. In a study running over 250 days median, 15% of patients had to permanently discontinue niraparib due to adverse effects. Interactions. No clinical interaction studies have been performed. The potential for interactions with other drugs is low as niraparib and its main metabolite MON do not significantly interact with any of the important cytochrome 450 liver enzymes in vitro. Niraparib, but not MON, is transported by P-glycoprotein and BCRP, but does not significantly inhibit them. Neither niraparib nor MON significantly interact with any of the other important transporter proteins. Pharmacology. Mechanism of action. Niraparib is an inhibitor of the enzymes PARP1 and PARP2. Pharmacokinetics. 73% of ingested niraparib is absorbed in the gut, and it reaches highest blood plasma concentrations after about 3 hours, independently of food intake. In the circulation, 83% of the substance are bound to plasma proteins. It is inactivated by carboxylesterases to the main metabolite MON, the carboxylic acid derivative, which is subsequently glucuronidated. The mean biological half-life is 36 hours. 47.5% of the substance are found in the urine and 38.8% in the feces. Unmetabolized niraparib accounts for 11% in the urine and 19% in the feces. Chemistry. The drug is used in form of the salt niraparib tosylate monohydrate, which is white to off-white, non-hygroscopic crystals. Studies. A 2012 study in a cell line found that PARP inhibitors exhibit cytotoxic effects not based solely on their enzymatic inhibition of PARP, but by their trapping of PARP on damaged DNA, and the strength of this trapping activity was ordered Niraparib, Olaparib, Veliparib. History. Niraparib was granted Fast Track designation by the U.S. Food and Drug Administration (FDA), and Tesaro submitted a new drug application in 2016. It was approved on 27 March 2017 in the U.S. and approved in European Union on 16 November 2017. In a study with 553 patients, progression-free survival PFS for patients with a deleterious or suspected deleterious BRCA mutation in the germline was 21.0 months under niraparib therapy, as compared to 5.5 months under placebo. Patients without such a mutation had a PFS of 9.3 months under niraparib versus 3.9 months under placebo. The U.S. Food and Drug Administration (FDA) granted the application for niraparib Fast Track, Priority Review, Breakthrough Therapy, and Orphan Drug designations.